High-quality sleep is essential for a healthy body and a healthy mind. Physical and mental health, our immune function, and our thinking are all impacted by lack of sleep. Having pain can make it difficult to fall asleep or even stay asleep, and neck and back pain are no exception. Hello and welcome back to our channel. This is Dr. Fatima, and today we are going to talk about the best positions in order to avoid neck and back pain. So if you're interested, please stay tuned. In 2016, a group of researchers worked on a study evaluating the effect of sleeping position on the back pain. They selected patients with back pain and divided them to two groups. Then they instructed one group about the optimal sleeping positions based on the pathology of their back pain and just let the other group to sleep like they always did. The results were really interesting and showed that the group that were instructed had significantly lower complaints about their back pain compared to the other group. When we sleep, it is ideal for our spine to be in a neutral or at least straight position. This means that we don't want the neck to be bent too far up or too far down. And we don't want the rest of spine to be super twisted or with exaggerated curves. Let's talk about some of the main causes that people have pain during the night and some small changes that can help with this pain. Let's first talk about low back pain. So if you wake up during the night or in the morning with low back pain and stiffness, this pain can be due to your sleep position. You don't necessarily have to change your sleeping position altogether, but if some modifications of that position isn't helping, it could be worthwhile to change, even if temporarily. If you are a stomach sleeper, you should know that this position is really tough for your spine to handle. That is because often we increase the lordosis or the curving in the lower spine by sleeping in this position. In order to correct this position, try placing a pillow which is not too puffy under your hip bones and lower core, which helps raise your hips slightly to be more comfortable for longer durations. If you're a side sleeper, you should know that sleeping on your side can be a great position for low back pain. That is because this position lets you to get some space into your joints by curling your legs a little bit in. However, even this position can cause some lower back pain or hip pain in people with some specific body shapes. We are talking about the people with wider hips and small legs, or wider hips and a small waist. If you have one of these body shapes, try placing a regular bed pillow between your legs, fully from the knees to the ankles. The pillow will be long ways to help even out the space between your legs and take some tension out of the low back. If you have a small waist, you can put a pillow or a rolled up towel under your waist to help decrease the space. If you're a back sleeper, you should know that sleeping on your back can pull the hip a little bit forward, and therefore it can lead to increased lumbar lordosis or the curving of your back, causing you to have pain at night. So if you're a back sleeper, try putting a pillow under your knees or your calves. This can help relax the back muscles, and you can adjust it up or down slightly to your comfort. The other type of pain that you might have because of a bad position of sleeping is neck pain. Walking during the night because of neck pain or numbness and tingling can be frustrating. It may also be difficult for you to find a comfortable position to fall asleep in. So I'm going to teach you some tricks that you can do with a towel and rest more comfortably. So let's start with your pillow position. Your pillow only belongs under your head and your neck, so you should be aware that your pillow should not come down underneath your shoulders. So if you're a side sleeper, sleep on your side on a flat pillow. Sometimes the bottom of your pillow isn't fluffy enough to fill the space between your shoulder and your head and keep the neutral alignment of your spine. Try folding a towel so it's the size of your pillow lengthwise. Then roll up the towel on the long side so it stays as long as the pillow. And then push it into the bottom of your pillowcase and it will sit in front of the actual pillow in the casing. Now when you lie on your side, you should feel more support under your neck. There are also some medical pillows which are designed to solve this problem. I'll put the link of some of them so you can check them out for yourself. Now, if you're a back sleeper, you might have this question in your mind about how many pillows you should use. Well, actually, this is a multifactorial question, since in specific conditions such as gastroesophageal reflux or sleep apnea, you might be suggested to use more than one pillow. But in a normal situation, our goal is to keep your spine in a neutral position. So if you feel like one pillow is too flat, but two pillows are too high, you can use a towel with the same size as your pillow. You can use one or even two towels depending on the height you need. Place these towels inside the pillowcase on the bottom side of your pillow. This will raise the entire height of the pillow slightly, while keeping some firmness underneath. If any of the changes that we mentioned made everything worse, stop it right away. That's not the goal here. However, if it's just hard to get used to, but it makes you feel better, give it some nights to adjust. Prolonged and severe pain or numbness are factors to seek medical help, since just a pillow or positional adjustment might not be enough for you. Also, if you have a lower back pain that you think is not related to your sleeping position, you can watch my other video on lower back pain in which I explain about the causes and treatment of back pain. That was it for today. Thank you guys for watching, and please don't forget to like, share, and subscribe. And also, if you have a medical problem that you think I can help you with, just leave a comment below and I'll try to get to it as soon as possible. Bye!